Hello and welcome to Health Reform Watch. I'm David Morgan, Healthcare Policy Correspondent for Reuters, and I'm here today with Professor Katherine Swartz, who teaches health, policy, and economics at the Harvard School of Public Health. How are you, Katherine?
I'm good. How are you?
Fine. As you know, President Obama today nominated his budget director, Sylvia Burwell, to replace Kathleen Sebelius as the Secretary for Health and Human Services.
Sylvia is a proven manager, and she knows how to deliver results. And she'll need to be a proven manager because these are tough tasks, big challenges.
One of the questions on many people's minds is what sort of challenge Ms. Burwell will face as head of the department if she's confirmed by the Senate. Can you enlighten us a little bit?
Well, first of all, I think it's important to recognize that the challenges she's facing are daunting. I think that anybody who will now be the new Secretary of HHS in dealing with the Affordable Care Act is facing some pretty difficult problems in going forward. She starts, however, with at least 7 million or more, perhaps closer to 8 million people who did enroll in the marketplaces between October 1st and sometime this past week. So that's a good start. I think that the challenges facing her come down to sort of two basic sets of challenges. One is maintaining the momentum in creating these marketplaces across the states. And the second is in making sure that people can enroll pretty easily in the plans that are being sold in the marketplaces.
When you talk about maintaining the momentum of the marketplaces, what do you mean? What does that take?
Well, we already know that the premiums are lower in the states that have at least 3 insurance companies selling plans in the marketplaces. So there are a number of states that have 1 or only 2 of the insurers or other health plans. And so the first role of business is to maintain this momentum in terms of trying to get more insurers in those states and to make sure that the insurers that already are in a number of the states decide to stay through 2015. The second part of this momentum is that getting younger, healthy people to enroll is really important because both having more insurers to try and to compete to keep premiums down, as well as having a younger but also really healthy set of people who have health insurance through the plans sold in the marketplaces. Both of those are needed to keep premiums affordable. So I think when I'm talking about trying to maintain the momentum here, it is both on the supply side in terms of the insurers competing, but also making sure that people who are healthy, who are younger, some of whom have not yet enrolled in coverage, realize that they can still enroll in the next open enrollment period. The expectations are that the people who enrolled, particularly from, say, mid-March through this past week, all the anecdotal evidence is that a lot of them are younger people who suddenly realize that they could face a substantial tax penalty if they did not enroll in some type of coverage. You know, the word on the street up until about mid-March seemed to be that you only had to pay $95 if you chose not to buy a policy in the marketplace this year. And that wasn't quite right. It was actually whichever is higher, $95 or 1% of your household's adjusted gross income, which is substantially more than $95. So the anecdotal evidence is that a lot of parents said to their adult children, you better buy insurance because otherwise you could face a fairly large tax penalty. So my own guess is that when you look more closely, when we get these numbers later in May, we will find that many of the people who enrolled, say, from the 2nd or 3rd week of March through this past week are younger, and we would expect them to be healthy people.
What does the Secretary of Health and Human Services have to do to ensure that there's adequate competition in the marketplaces?
Well, for one thing, as part of the law, there are these so-called 3 Rs, which are basically adjustments to encourage insurers to realize that they won't face large risks of having a large number of people with very high costs who might enroll in 2014 or even next year in 2015. These adjustments will go on through 2016, and the total intent of this is to reassure insurers that they will not be at risk for having some number of people with very high costs. So that's the first thing, just reminding insurers that that's the case. Part of what HHS has to do is start fixing some glitches, or what I think of as sort of the shakedown cruise issues that didn't work quite so well in this first open enrollment period. So one of them, for example, is to point out that the November 15th through February 15th open enrollment season for the 2015 year, so our next open enrollment season, is going to close, that is February 15th, before most people will have discovered, if they didn't already buy coverage, that they might face a tax penalty.
How does HHS have to approach that? I mean, is there a potential, do you think, for a kind of amnesty in exchange for people agreeing to enroll in health insurance, or does the deadline, the February deadline, does that have to be extended to April 15th?
So I would say that, and other people have been saying this, that it makes some sense to extend this open enrollment season, or maybe not even start it November 15th, but have it start maybe January 1st or January 15th and have it run through the end of the tax season. Because that way, people will more accurately know what their income is for 2014. They'll know what tax credit subsidy they'll actually be able to get. They will know whether or not they face a tax penalty. And if they get a tax refund, many lower income people do get tax refunds, it will enable them to both pay some of their premiums for 2015 as well as pay whatever tax penalty they might have been facing.
Would the administration have an easy time changing deadlines like that after all of the political heat that they've taken over the establishment of special enrollment periods for people stuck applying for health insurance as the March 31st deadline passed?
They might take some heat, but I think framing the issue early as one that we're here to help people and that insurance reduces the risk of having very high health care costs is an important objective. This is a new law, and just like Medicare and Medicaid took between 3 and 8 years to really be implemented fully and to get past some of these shakedown cruise kinds of issues, these are good examples where both for the employers and for individuals, we're discovering some issues that, had we had more time and more political support, I think would have been fixed earlier.
One thing that I have to wonder about, given the fact that Sylvia Burwell is not really a household name, how much of a challenge is she likely to face as the head of the Department of Health and Human Services? And also, given the scope of the department, how much attention can she really give specifically to the Affordable Care Act?
Well, I think this relates to my point that I think that being the secretary of HHS, one faces some pretty daunting challenges across the board. However, she has a reputation of being an excellent manager, and that is clearly something that anyone running HHS has to be. And I give Secretary Sebelius credit also for being a good manager. So, you know, going forward, I think that Ms. Burwell, with this experience of being a pretty good manager by all accounts, she should be able to have a pretty good team, and there are already some excellent people at HHS in positions to assist her. So I think just getting everybody's eyes back on the ball, and in particular with the ACA, recognizing that the first year was the first year, and there are still a lot of issues that they need to keep up pressure so that they don't get caught by being flat-footed at the next open enrollment season.
Well, I think that's about all the time we have today. Thank you very much, Professor, for an enlightening discussion. And from Health Reform Watch, that's it until next time.